Thanks so much, Leanne. Thank you very much for inviting me. And it sounds like you've had an amazing day yesterday. I'm sorry I missed it, but I've caught up with a few of you on the way in and got the short version of what seemed to have been an amazing day. I'd like to also commence by acknowledging the traditional custodians of this land, the Turrbal and Yagara people of Meanjin, and pay my respects to their elders past and present, and to all First Nations people with us today, and especially to any young people, the emerging leaders in the First Nations community. As National Children's Commissioner, my role is to monitor policy and laws to ensure that they're protecting the human rights of Australia's children. My observation from this role is that despite decades of evidence of the failure of our service systems to meet the needs of children and young people, we continue to see governments struggling to build the systems scaffolding that is required to support children and their families with complex needs. This applies to all areas of policy for children, including for children at risk of maltreatment, like child sexual abuse. And as Leanne said, she's asked us to go very broad, so that's what we're doing this morning. Successive generations of researchers, practitioners and advocates join those who came before them, looking for the key that will unlock the required political commitment and cut through to those who need to be convinced. Depending on your perspective, you might believe that more academic research is the answer, or hearing directly the voices of children will convince decision makers, or more data, or economic benefit analyses, or program evaluations. Many would argue that appealing to our human rights obligations, including the right to self-determination, will make the difference. Unfortunately, none of the above alone will work to shift the dial sufficiently on policy reform for children and young people while we continue to face numerous barriers to evidence-based action that are rarely discussed. These barriers include the absence of core government mechanisms for accountability. These barriers are the elephants in the room that are blocking our ability to move forward with critical reforms. And it's not that nothing is being done. In fact, one of the barriers is actually the volume, the number of complex and disparate strategies, plans and frameworks currently found at state and territory and Commonwealth government levels. And they're too numerous to list here in this short time, but you will know that these plans often sit inside a departmental portfolio. One exception is the Closing the Gap National Agreement, which isn't just sitting inside one. Rarely do these plans acknowledge that the real life needs of children and their families are interdisciplinary and they span numerous portfolios. Children sit awkwardly at the intersection of Commonwealth, state and territory jurisdictions. Policy silos, which we're all very used to, they're designed to meet the administrative needs of governments, not the complex needs of human beings. One example of this that is important to me is now that we have the data from the Australian Child Maltreatment Study and more recent research like from Professor Silke Meyer and others, we now know that domestic family and sexual violence co-occurs with other types of child maltreatment. But in all of my career in child and family wellbeing, domestic family and sexual violence and child protection have been dealt with in separate policy silos, which I think has obscured the truth about these interconnections that often go back generations, and this disconnection has diminished the effectiveness of our policies. There are numerous blockages and barriers that we're failing to recognise, investigate and overcome. And as I said, these barriers, based on the evidence, are not often discussed. So I thought what I would speak about today are actually three of these barriers. There's more barriers, if you're interested in barriers, in the report called Help Way Earlier that I had tabled in the Australian Parliament in August, and you can just Google Help Way Earlier and it pops up. The first barrier I'd like to address today is the lack of understanding about childhood, child development, and the human rights of children. In my recent speech at the National Press Club on that Help Way Earlier report, I chose to spend a few minutes explaining what childhood is all about. And I did that because I had a large captive audience of a few MPs and a lot of government policy people, and because in this role I observe a disregard for the uniqueness of childhood in many of our policies. I'll just give you one example. Children are wired to seek a sense of connection and belonging. It's a deep human need. It's part of all of us, and it's especially important in childhood. Young children are dependent on others for their very survival, and that deep need for caring and nurturing relationships and a sense of belonging is an essential part of child development. In a positive sense, it ensures survival and well-being as the child grows, but it also means that some children can be vulnerable to exploitation by adults. So a lack of understanding about the unique needs of children can lead us to make incorrect assumptions and to underestimate the risks, as well as underestimate the protective power that meeting these needs can have for the positive well-being and safety of the child. At the same time, we also often diminish the agency and the rights of the children to be heard, and that means that children can be silenced and not believed. Building the capability of our service systems to enable children to be safely heard about matters that affect them, that continues to be one of our major challenges. There's also a lack of understanding about the United Nations Convention on the Rights of the Child and how the Convention is like a compass that can help to guide our decisions. It provides practical help to help us make better policy decisions. And unlike many other developed countries, we have no national act for children, and the CRC has not been incorporated into domestic legislation. Therefore, there's no accountability in legislation for protecting the human rights of children. The second barrier I'd like to mention is the federation, the F word, as some have said to me. Is this being streamed live to it somewhere? Oh. Okay, sorry about that. In our federated governance structure, policy affecting children is primarily the responsibility of states and territories, especially when it comes to our most vulnerable children. And, you know, this is reflected in our funding arrangements, and my understanding is that, for example, for health services, the Commonwealth Government provides something like 40% of the funding and the states kick in the 60%. For public schools, it's now, I think, 25% of Commonwealth, and then, except for the Northern Territory, that's up to 40% now. Only recently, the National Cabinet, in making women's safety a key priority, they also have new cost-sharing arrangements, and I understand that as part of the 6 September National Cabinet announcement, the Commonwealth and states and territories agreed to negotiate a renewed 5-year national partnership agreement on FDSV responses to commence from middle of next year, and that's the quantity is, I think, 700 million, 350 million is Commonwealth, 350 is the states together, and just over 11% of this funding is the 80 million allocated specifically for children, which is fantastic. It's these funding partnerships that typically determine the nature of the relationship between the Commonwealth and the states and territories. When it comes to child protection policy and youth justice policy, which is where you will find our most vulnerable children in this country, I'm advised by Prime Minister and Cabinet that the Commonwealth contribution is 0%. And it is also in these critical areas of policy affecting our most vulnerable children that despite decades of evidence of systems failure, we continue to hear the Commonwealth Government say, not our problem. It's a state and territory issue. And the states and territories say, in turn, we never signed up to the United Nations Convention on the Rights of the Child. That was the Commonwealth Government. So the division of responsibilities in the Federation allows child safety and wellbeing to be handballed back and forth over the net. And this was brought home to me starkly in the last few months when we had the second tragic suicide of a child in detention in Perth. And we also saw footage of a young girl with the intellectual age of 5 being manhandled by 3 police officers into an isolation cell at the Cairns Police Watch House. In both of these situations, the children could be described as being the subject of institutional maltreatment. But to date, no one has been held responsible, not the states in which these tragedies occurred, and definitely not the Commonwealth Government, who showed no willingness to get involved. Similarly, last week, when the Northern Territory Government passed a law to lower the age of criminal responsibility down to 10 years, contrary to the evidence of what will actually prevent crime by children, and in the face of massive objections from medical experts, legal experts, all the peak bodies in those professions, plus, numerous other advocates for the rights of children, again, the Commonwealth Government remains silent. So the fact that Australia ratified the Convention on the Rights of the Child almost 35 years ago now, is in reality meaningless. It's literally of no consequence to those children that I mentioned and many others. And this has been noticed internationally, with the chair of the United Nations Committee on the Rights of the Child speaking last Friday to the Australian media about the lowering of the age and also writing to the Prime Minister. And it's received quite a lot of international media attention. So the third barrier I'd like to briefly mention is the lack of political will to make child safety and wellbeing a national priority. The accountability mechanisms that we use for other social problems are missing when it comes to children. A key barrier to action is the fact that child safety and wellbeing is not a national priority for the Federation. There's an official list of key priorities for National Cabinet. In case you weren't aware, you can Google that as well. Recently, we've seen National Cabinet convene 2 special urgent meetings on gender-based violence, and women and women's safety is listed as a key priority for National Cabinet. This is urgent and important work. Previously, it was considered a state and territory responsibility alone, but it's now recognised as requiring whole of Federation action. Same with other policy areas like housing and homelessness that were previously just state and territory, but they are now dealt with as a priority under National Cabinet. From the Prime Minister's media statement after the September National Cabinet meeting on gender-based violence, and I'll quote, "First Ministers acknowledged that a coordinated approach across all states and territories is required to address this national crisis." I don't think anyone would disagree with that. As I mentioned earlier, there was funding specifically for children. I'm sure Micaela will mention this when she gets up, and it is an excellent first step forward. We've had a Cabinet Minister for Women for decades, and we have an annual women's budget statement at budget time that provides transparency and accountability for expenditure on women. Again, these are excellent initiatives that should be applauded, but we have none of this for children. No Cabinet Minister for children, no budget statements on child wellbeing. Based on official documents, not my opinion, child safety and wellbeing is not a national priority for National Cabinet. In fact, if you look at that list of priorities for National Cabinet, you won't see the word children anywhere on that list. I think we need to be asking why. If National Cabinet's oversight is required for other complex and critical issues, why not for children and their safety and well-being? Reform requires the political will to systematically identify and address the barriers that block the implementation of evidence-based action. We've made assumptions, for example, that child protection can be managed effectively by separate laws and policies in individual states and territories alone. I think we were wrong. This was devastatingly clear to me when I visited the tri-state area in Central Australia, where the borders of Western Australia, South Australia and Northern Territory connect. When families travel across the borders, vulnerable children become invisible and their families miss out on the support services that should be helping them. Information is not shared and the jurisdictions are not working together on child wellbeing. This story is seen repeated across Australia despite the fact that we are one country. We see large differences in child protection laws and policies and practices, but no one is asked to explain how these differences could be in the best interests of Australia's children. As with other critical and complex areas of policy, such as domestic family and sexual violence, we need to work together across the Federation and there needs to be national coordination. Importantly, we need National Cabinet to urgently make child safety and wellbeing a national priority for the Federation. And by the way, colleagues, this could be done with a stroke of a pen, immediately. And it would pave the way for building coordinated national action and greater accountability for evidence-based reform. So, in conclusion, I wanted to just mention that about the fact that in recent years we've seen numerous tragedies involving children, as you know, often followed by calls for yet another Royal Commission or inquiry. And one of my first national objectives as National Children's Commissioner was to try to understand what have we learnt from these past inquiries and Royal Commissions. So we made a list of the recommendations from a decade of Royal Commissions and inquiries. We focused on child protection and youth justice. And a report was then prepared for us by the Australian Institute of Family Studies that analysed inquiries held between 2010 and 2022. In the 61 reports that were analysed, there were 3,005 recommendations with 6 core recurring and overlapping themes. The repetition of these evidence-based recommendations demonstrates a chronic lack of accountability for action and a lack of a sense of urgency by governments. I'll just mention the 6, just so you get a feel for it, the 6 recurring themes that the recommendations were grouped into. Inadequate cross-system information sharing, collaboration and coordination. Limited First Nations partnership and self-determination. Limited child protection and youth justice workforce capability and support. Inadequate levels of investment, especially in prevention and early intervention. Lack of mechanisms for oversight, monitoring and transparency, and limited opportunities for child voice and participation. The repetition of these findings should be a wake-up call that stops us calling for more inquiries. What we need to do is identify and overcome the barriers to evidence-based action and the lack of accountability for the human rights of children. And I think, colleagues, by pulling together and speaking up with one voice for children, I believe we can influence government leaders to make child safety and wellbeing a priority across the Federation and a key priority for National Cabinet. We need to make this Federation work for all of us, for all our citizens, including for our youngest citizens. Thank you very much.
Thank you, Anne, and thank you for making the time to be here and to encourage us to stand together for children. We are very keen to now welcome Micaela Cronin. She began her career as a social worker in family violence and sexual assault services. Since then, she's held leadership roles across the social service sector in Australia and internationally, including as the president of ACOS, the Australian Council of Social Services. Micaela was also CEO of an international non-government organisation based in Asia, working to build global service delivery and strategic partnerships to tackle human trafficking and human rights abuses. In 2014, Micaela was awarded the Robin Clark Leadership Award, which is Victoria's most prestigious child protection award, in recognition of her leadership in inspiring others to achieve the best outcomes for children, young people and their families. Welcome, Micaela, thank you.
Thank you, Leanne. It's very good to be here, and it's a bit hard to, that's a hard act to follow. That was a very impressive and thorough speech, so thank you very much, Anne, for all the work that you do and your leadership. I want to begin by acknowledging that we are on the lands of the Turrbal and Yurraga people and pay my very deep respects to them, and I'm sad to have missed the welcome yesterday. I think when I lived overseas, one of the things that it felt like a yawning gap. It felt like I wasn't grounded when we began important conversations like this, when there wasn't an acknowledgement. And I realised how significant and in my bones it is that this is the way to begin, to acknowledge the lands that we are on and to thank the people for the care of these lands and the ritual of being welcomed to this place. So thank you for the acknowledgement of the welcome yesterday. I want to also just build on that a bit in thinking about First Nations people, Aboriginal and Torres Strait Islanders leadership. One of the things I want to, in thinking about why are children and child sexual abuse, why is it forgotten? Recognising that the incredible work that has been done by Aboriginal and Torres Strait Islander people across generations in leading in this work, how forgotten and unheard that work is. Last week, the 7th person died as a result of family violence in the Northern Territory. All of them were Aboriginal and Torres Strait Islander people. 5 of them were women. One of them was a sister girl, and most of the media about that was not inclusive, and one man. We had, and despite people's efforts, including mine, we had very little national attention to that. Northern Territory has the population the size of Hobart, and it's smaller than Geelong, a regional city. And if we had seen 7 people die in the space of 4 months, anywhere in this country that weren't all First Nations people, there would be inquiries called. There was an inquiry in South Australia called, and as Anne said, quite rightly, important national attention. We had a National Cabinet called on the back of the national outrage about the deaths that had been occurring. We have not had the same response to those deaths in Northern Territory. And I find that deeply disturbing and distressing. And I think my primary kind of answer in thinking about, and I've been reflecting on the question that Leanne gave us, the ongoing impact of colonisation and systemic racism in this country is absolutely at the core of why we are not recognising and responding to children in the way that we should be. One of my, our child protection system was designed by people who sent their children in boats to this country for stealing bread. That's not the kind of approach to child welfare that we want to see. We have a great deal to learn from Aboriginal and Torres Strait Islander cultural approaches, historical cultural approaches across. And while I was at the KWI, no, it was actually our roundtable, we had a welcome in Adelaide. The woman who did our welcome said 2,600 generations, which is an incredibly rich way to describe the care for these lands. Yes, tens of thousands of years, but 2,600 generations. And we have a lot to learn and a lot of ongoing harm to address. I want to also acknowledge in saying that, and Leanne, I'm really sorry I missed yesterday. It sounded like it was a very rich conversation, and you have put enormous effort into this conversation, bringing together diverse perspectives. And I want to acknowledge that there is you've made an effort around significant lived experience engagement, both in presentations and in the conversation more broadly in people here. So I would like to acknowledge the people with lived experience who have spoken, who are here, who courageously stand up to share their most deeply personal experiences of having been harmed, having been shamed and humiliated, with a passion to drive change for others. And I have enormous respect for people who choose to do that and do that in a way and continue to share, because I think people do stand up and listen in a very different way. But every time someone stands up and talks about their personal experience, they are giving of themselves in a way that most of us don't do when we stand up and speak like this. So I want to acknowledge that and thank them for their courage. In saying that, I do want to introduce myself a bit, because I think bringing ourselves into these conversations is important. I'm the daughter of a migrant on these lands, and I am deeply grateful for the welcome that my family has had, and to the Aboriginal people and elders who have supported and taught and grown me up. I did start working in family and domestic sexual violence. No mistake, like many people in the sector, I have my own lived experience that I bring to this work. And I think that's one of the other things when I think about barriers to why are we not doing better? One of the things I think we learnt from the child maltreatment, the incredible work that was the child maltreatment survey, is not just what all the data in it told us, but what the national and policy response to it told us. Because how much has there been? I was shocked at how little national attention that data received, because it's quite shocking data, not for the people in this room, not for those of us who've worked in this sector for a long time, but it is deeply shocking, the level of child abuse, the level of maltreatment. I think part of what we do is we collectively dissociate. We have children, we have lived experience over here, and then we have professionals who design policy and service responses, and we don't bring all of the parts of ourselves together. So I want to bring myself to both this conversation and to this role. I also want to acknowledge that my pronouns are she, her. And I think when I first came back from Asia, it had become a thing to do that. Really wasn't beforehand, and it took a little bit of educating for me to really understand why that is so important, to acknowledge that. Until we value and treasure gender diversity, again, we are not going to tackle these incredibly intransigent problems. Until we recognise that there is gender diversity, it's not binary, we are not welcoming and treasuring all that brings, and all of what happens, again, when we silo people in their gender. So it's important to call that out, and it's important for us to acknowledge that in the language that we use. So I commenced as Australia's first Domestic, Family and Sexual Violence Commissioner in a couple, next week I think, it'll be 2 years. And when I started, I had this view about what commissioners' jobs were to do, largely from watching people like Anne and the other human rights commissioners. And what I realised in starting this up is that I don't have 35 years of the history of what came before the Human Rights Commission to build on. Part of mine and my small office's team's job is to create and shape what it is that we will do, because it's such an incredible breadth of issues that are so important to shifting the dial. And we tabled our first yearly report to Parliament this year, and in that report we identified, based on having had thousands of conversations across those 2 years, and again, in the same way that Anne's talked about, very consistent themes came up in all of those conversations that are very consistent with the points that Anne raised about every inquiry. So every conversation that any of us have when we engage with people, however formal or informal, the themes are very consistent. Our system is causing harm. Our workforce isn't adequately supported or resourced. We need to, one of the most consistent themes that I heard, and I heard it on, I think it was about day 10. I started in the role and I decided the first thing I wanted to do was to get out into community. And one of the Four Corners report into murdered and missing women had been aired the week before I commenced in the role. First place I went was Alice Springs. And one of the first things that the women I met with in community talked to me about was the need to engage with men and boys. That until we are engaging with men and boys again, we are not going to shift the dial. So, in terms of the priorities that we identified in our first report, workforce systems governance in the way that Anne has talked about, in terms of needing to have much better governance arrangements than we currently do, including the challenges of federation. Improving the capacity of our systems. We know that our systems are causing harm. They are actively causing harm. They are not just not fixing harm, they are causing harm. Child protection are removing children into situations in which they are much more harmed than they were in the situation that they were in. We know that. We know that. We know that the gap between the way the family law system is functioning and child protection is causing harm, significant harm to children. We know that women are not reporting to the police because they're just as likely to be misidentified and have their children removed. So we know that the way our system is set up at the moment is causing further harm. So we will continue to have a focus on improving the capacity of our systems. The last area that we dedicated attention to in the report, and will be an ongoing theme throughout the Commission's work, is embedding lived experience, because I do believe that that is critically important for a range of reasons, one of which is that alongside what the evidence and research tells us, it tells us, but it tells us in a much earlier on. It tells us when our approaches, our policies, our services are not actually having the desired impact. The child support payment policy was championed by women who wanted to improve the lives of women. It's now being weaponised. Women are suffering as a result of. It's being weaponised by perpetrators of violence, men who want to cause harm to their former partners, and we're having to unpick and unpack the challenges that system is causing. Family law, again, was championed as something that was going to be really good for women. No-fault divorce. You couldn't argue against that as a policy that was intended to be helpful and shift and improve the lives of women and children. We now know that it is significantly causing harm. So we need to be listening to people who are closest to those systems, who will early tell us when they are causing harm, who will stand up and hold us accountable and look us in the eye and tell us the truth. Truth-telling is critical. People who live who share their lived experience we need to have truth-telling processes. And we need to embed those processes in an ongoing way so that it's not just the next inquiry or Royal Commission that makes further recommendations. It needs to be embedded and ongoing. In terms of what the Commission is going to be prioritising for the year ahead, we will continue with some of those priorities. So systems harm, lived experience engagement of men and boys. But what we've recognised is that we haven't been paying enough attention to children and young people and sexual violence. So those are the 5 priority areas that we will focus our attention on this year. The team we tried to get it to 3, 5 is a lot, but all of those are really critically important and interconnected. We can't be talking about the importance of engaging better and really shifting the dial, as Anne so eloquently put, around children and young people if we're not looking at all of those other things. I started off working in my first serious job after making sandwiches and doing other things was working in a women's refuge. And there was nowhere on the form to even count children. We didn't even count them. They were accompanying women. And one of my still long dearest friends was the first children's worker. And the Women's Liberation Halfway House had cobbled together the funding for that. That's nearly 35 years ago. And organisations are still cobbling together funding to address children and young people. They still have sole workers who pay attention to children, Aboriginal and Torres Strait Islander, what is seen as specialist issues. They need to be at the core of my job. When I left the Women's Refuge, I went and worked at a sexual assault service, and I was employed as the youth homelessness worker. And one of the first things that was a challenge in terms of even the system at the sexual assault centre was that the organisation had a policy, wasn't just that one, that we don't work with people who are homeless, because until you've got stable accommodation, how are you going to do long-term therapeutic work? Well, until you've got a house, how are you going to do any recovery and healing work? So I started my career in this space, and I am deeply disturbed about how little movement we have seen, and actually how further harm is being inflicted. Because I think some of the ways that our plethora of national plans, continue to silo the issues, continue to not integrate. I agree with Anne said that the Closing the Gap strategy and principles is the one piece of work. I think it's one of our best, nationally, it's one of our best pieces of policy work, because it does look at the whole life course, it does look at the whole person, it does identify what the system's barriers are that will make a difference. I think that's really our shining light in terms of what the direction is to drive change, why we are not seeing children and young people more at the centre. And again, we don't have the data to measure whether or not the targets that are in that plan are being measured appropriately, whether we're seeing traction. So the one national shining policy light, I think, that does encompass and talk about children, we've still got a lot of work to do. We've still got an awful lot of work to do to support and embed that. And I would support the barriers that were outlined by Anne in terms of why that is the case. I also think, I've been thinking deeply about the question that we were given in for this panel, and just in closing, I think that the other thing we really need to be thinking about is healing and recovery, is our cultural approach to why is it that this country saw the child maltreatment study survey data and didn't see that as a wake-up call, didn't see that as that means every room that we are in, there are people who have experienced child maltreatment. And we need to be having the conversations about how do we incorporate that into how we're thinking about policy and service design. How do we help those people heal and recover? We don't invest enough in that. And how do we ensure that as a country we heal from what is at the core of the ongoing harm of colonisation, and why I think that is critical. The healing from that is critical actually to addressing the issues for children more broadly in this country. Thank you very much.
Thank you, Micaela, and thank you for connecting the dots in the way that you were able to bring the perspectives and the priorities that the Commission is thinking about going forward. I am really honoured and privileged to now introduce Catherine Liddle, who is the Chief Executive at SNAICC, the National Voice for Children. For our children, I beg your pardon. An Arenti Laricha woman from Central Australia, Catherine has been a leading advocate in upholding the rights of Aboriginal and Torres Strait Islander peoples on a national, regional and local level. Catherine has held senior management positions in First Nations organisations, including First Nations Media and Jawoyn Indigenous Corporate Partnerships, as well as within the Northern Territory Education Department, the ABC, and NITV SBS. She's a journalist by trade. Catherine's motivation has always been to drive change that leads to positive outcomes and options for First Nations people. Over the past 10 years, she has led multidisciplinary teams, overseen workplace transformations, and advocated for policy reform. Catherine is the CEO of SNAICC, the national non-government peak body for Aboriginal and Torres Strait Islander children that works for the fulfilment of the rights of Aboriginal and Torres Strait Islander children, in particular to ensure their safety, development and well-being. Please welcome Catherine.
Good morning, everybody. I reckon it's sometimes uncomfortable standing up on 4 podiums like this, but you know, the most uncomfortable part is having to listen to your bio. And every time I listen to it, I think I've got to fix that and I've got to make it tighter. But it always falls off my continuous improvement list. And one of the funny things about my awesome, extraordinary team is we're constantly trying to update things. How could we communicate better? How do we change the conversation better? Which means that every time I walk into a room like this, I'll leave with a set of dot points for continuous improvement. Every time I see a PowerPoint, continuous improvement, because I'm looking at how everything that we do lands and resonates with the people around us. Oddly enough, the other day they were looking at something that had managed to got past me, and they were laughing about it because in it was a comment relating to how our Aboriginal community controlled services work, and it was meant to read continuous improvement because that is how Aboriginal community controlled services worked. And it actually said, and that this is why they found it funny, continuous approval. And that's not such a bad thing either. So it is a pleasure to be standing here in front of you all today, and also a pleasure to be on the lands of the Yagara and Turrbal people. I love coming into this country as an Aboriginal person because a lot of the stories that I read in the landscape around me resonate so closely to the stories that our mob share in the Central Desert regions. In particular, as you fly into this country and you watch how that beautiful rainbow serpent moves around the river, and if you're not familiar with watching how the rainbow serpent moves, it's in the glinting of the light. So next time you're flying, take a look at that glinting and you'll see that beautiful, powerful creator of change moving through the landscape of this beautiful country around us. It also reminds me of my family, so the Lurija and the Aranda people of Central Australia. Now that Lurija side also encompasses a group called the Purdama. The Purdama are the people of the rivers, and my family have significant responsibility to those rivers, those great serpents. And for me, that is one of the things that shows us how we connect to this country. I know with great certainty that those beautiful serpents that I see when I fly in through the air are the same serpents that we share, and it makes me feel safe and it makes me feel connected. And I think Commissioner Hollonds spoke to it when she said, we need belonging, and these are the stories that I was taught as a child, and they're the stories I carry with me as an adult that show me where I belong and how I can belong in the world around me. So I want to share with you a story from my country, from the Purdama lands, and this particular story is one we share with our children around how you identify where you are and what the potential risks are. And if you're not familiar with our ways of telling those stories. Everything we read in the landscape has a story that relates to policy. It has a story that relates to frameworks for behaviour. It has a story that relates to how you manage risk, how you identify risk, how you mitigate risk. And it has a story that talks to what happens if you fail to adequately care for the world around you. And while the stories might seem flat, all of those stories are embedded in what is technically a flat story. So I'd encourage you, while I tell this story, to think about how it relates to all of the things we're talking about today, and to dig past what might seem like the most obvious story in it. So this one is about an emu, and I chose to share this one today because of all the stories that my family tell and that I have responsibility for, this is the one that bothers me the most, because I don't understand it. I don't understand how this came to be, and I don't understand how to help this particular being. I don't have the tools. So as you're coming past the Hugh River, our beautiful Hugh River, one of the oldest in the world, you know that you're entering a landscape where the desert oaks will start to grow. If you're not familiar with our desert oaks, they are giant. They are absolute giant willows, and when the wind blows, it will not only kick up the earth around it, that soft, beautiful bull dust, I think is the appropriate word for it, but it picks it up and it starts to dance with the movements and the legs and the arms of our ancestors, but those giant desert oaks start to sing the song that matches the beat of that dancing earth. And you go just a little bit further to your left, and there's this rocky outcrop. That's a mountain, and it's disconnected from the mountains further south. It's by itself. And when you stop and you look at that mountain, what you see is the shape of an emu, this giant emu. And to be clear, the emus no longer live in that area. There's too many desert oaks. So this poor emu, he's been chased by dingoes. And I don't know how familiar any of you are with dingoes, but they are clever. They are clever, they are machines, they know how to hunt, and they set up this beautiful howl, and that howl calls its brothers and sisters, and in they come en masse, and they isolate and they chase and they wear you down until you have nothing left. So this poor old emu has been isolated, and it's used its only power and its only tool that it has. It's run for the rivers, and it's run as fast as it can, chased by those dingoes. And those dingoes have caught it sometimes and then let it go, because something else happened over here. Something else was going on. So the dingoes reorientate and they run after whatever it was making noise on the other side. And this poor emu falls on top of itself. It is exhausted, and it wraps its head around its body and its legs fall underneath. And you see this in the landscape. And there it stays, forever, stuck. It has nowhere to go. Its legs will no longer take it. Its only method of being able to reach safety no longer available to it. It's not dying. It's not living. It's not moving. It's in stasis. It is stuck, forever frozen in time, to let us know that something went wrong. There is no way to help this emu. So I'll let you think about the many stories that you might be able to read into it. But when I think about that story, the first thing I think about is policy. I'd also be remiss if I didn't, in this room, immediately call out those other stories that have potentially been shared amongst us today, in particular those people that have shared their stories about lived experience. And I'm sure when you're listening to the emu story, you're probably seeing multiple layers in what that emu story was telling you. Those are the stories that we need to hear. They are the truths that we need to hear. So many times our recommendations are ignored. So many times the truth is pushed from pillar to post and buried under a pile of things that make headlines instead. I know you've heard a lot today about what we need for reform. I know you've heard a lot over the past few days about what our children need. And essentially, that's the reason SNAICC exists. We were stood up more than 40 years ago because what we knew was the systems and the policies that Australia had for children were harmful, but no children were harmed at the scale and impact that Aboriginal and Torres Strait Islander children were harmed at. Some of those policies were quite frankly horrific, and unwrapping them today still remains a challenge, because while technically the policy is dead, the behaviours and the practices that inform them still exist. Our job is to change that conversation. Our job is to change the way those policies are embedded, how they're written, how they're evaluated. Our job is to ensure that when people are thinking about these things, they're thinking about our incredible culture, and they're thinking about those 2,600 generations, and they're thinking about what we've learnt, and they're thinking about how strong we are, how clever we are, how we lead Australia in the understanding of what integrated service delivery looks like and should look like, and how you should care for your children and your families. Everything that we do is driven by the voices of others. It is driven by the experiences of our children and our young people, our families and our communities. It is our job to amplify it. It is our job to find the conversations, and it is our job to interrupt those conversations for change. As you've heard, the existing systems in Australia fail, and they fail our children in particular, because we weren't in those rooms. They were built without us. They were informed without us. And more importantly, some of those systems, as you know, were built and specifically designed to break us, to break our families apart, to diminish our culture and our own systems and our own policies. If governments are truly serious about committing to outcomes for children, then they have to commit to doing things differently. So what should be the starting point for this change? That's always the hardest part when you're looking at a giant elephant. Where do you start? I think every person in this room would agree you have to start with understanding that even one case of child sexual abuse is one case too many. We have to start by being uncompromising in our commitment to ensuring safety for all children, and that means telling the truth. So the truth is, and you've heard it from both commissioners, that families keep children safe. Our cultures keep families safe. Now, that's not to say that sometimes this goes wrong, but families need to be looked at as a whole family, and cultures and communities need to be looked at as a whole culture and a whole community. For our mob, women's law, grandmother's law, men's law, it was divided into laws that protect children and families. That was at the centre and the heartbeat of all of our policies, and we've been doing it for tens of thousands of years. What we hear in the media at the moment is what gets headlines, and unfortunately, a lot of what makes headlines is a rhetoric that talks of a lack of safety within our cultures and our communities. We hear claims that our communities are rife with perpetrators and our children need to be taken away. It is a familiar story for our people, and it is categorically not true. As the Commissioner cited, our children are irrevocably harmed every time they are removed. Very rarely are they removed to situations where they were safer. The commentators do not use evidence. They use our most vulnerable children as political footballs. And I heard Commissioner Hollonds refer to it as handballs. We don't use the word handball because in actual fact our children are kicked from pillar to post. Their families are demonised. They are used as weapons. Another way of referring to this is political point scoring. This is not safety for our children. There are genuine issues that we need to address. And worse than this, we know what comes next. We know what comes after the headlines. We have endured this time after time, government after government. We know what the rhetoric leads to. It doesn't change the circumstances that we exist in. It doesn't target poverty, and it doesn't target the experiences of trauma that have resulted from decades of racist policies. And that's an uncomfortable word, but this is an uncomfortable conversation. It doesn't change the practices that have impacted on safe environments for children. What did they actually need? What did a family need. How do we put a child at the centre of that? It doesn't look at how we heal our communities, how we heal our families, how we care for our most vulnerable children. It doesn't address what we need to take children safe. Our children are safe, and you'd know this, when they have strong networks of kin around them to watch out for them, people that they can go to, people that they can trust, people that understand what they are saying, people that can read them when their behaviours change. Our children are safe when our families know how to seek help, when they know who to talk to when they're struggling, when our families don't need to hide because they are scared of judgment, because they are scared of their children being removed, because they are scared of the discrimination they face in the structures that apparently keep us all well. For generations, what we've seen is colonial systems tear our communities apart. And again, that's an uncomfortable word, colonial, but this is an uncomfortable conversation. That tearing apart has left us even more vulnerable. We know that when our children are taken into out-of-home care, and we know that it happens at alarmingly disproportionate rates, they are placed far away from their communities, far away from their families, and a significant number of them will never speak to their siblings again, will never know their nanas and grandpas or their uncles, will never be able to walk into a room like this and tell the story that their communities were built on. We know that they have been dislocated forever, and we know the harm that comes with that. They are also subjected to deep emotional trauma that comes with the loss of identity, the loss of knowing who you are, and a separation that breaks down their own communities as those families deal with the harm of that removal. And, as the Commissioners both cited, they are also more at risk of physical harm. But this is a conversation about changing that. This is where we need to see hope. This is where we talk about how we can change this and keep all of our children and all of our families safe. We need to, again, remind ourselves at all intervals that what we're talking about is having children and victim survivors at the centre of all the work that we do. It means that we need to change the system, because right now our children have to fit into a system, not give the children what they actually need. You cannot address complex needs with discrete programs and policy solutions. And we heard about what that even looks like in the federated model today. Different laws, different legislations, different mechanisms, different programs, different funding cycles. This will never work for our children and families. These support systems need to be working together in order to deliver care for our families. Much like the ACCO models, they need to be holistic, they need to be culturally responsive, they need to be responding to the hardships that exist in each unique community, and to be able to give the supports in a way that is critical and relevant for people in those communities. For our children, the only way we see that working is through our Aboriginal community controlled services. We refer to them as ACCOs. ACCOs, as we've said, lead the gold standard on holistic service delivery. Many of the newer models that are purported today as being successful are rooted in that evidence. However, we often hear policymakers talk about models that come from internationally acclaimed practices, and yet all of them match what we have been doing in Australia for more than 50 years. An example of that is they don't think of only looking after a child. Everything that the ACCOs do relates to the ecosystem. And again, when I talk about that ecosystem, go back to that emu. How many different ways does that emu apply to an ecosystem? They're not only childcare providers. So, for example, our early education and care systems are built to respond to the whole of family. This is not only where a child has access to early education and development practices, it also has the ability to have something like a meal. In some of our families, particularly in times of disruption like floods and fire, that might be the only meal that child will be able to eat. But while you're having that meal, in comes mum and dad and has a conversation. So you're picking up stories that relate to the child's developmental needs in a way that you could never get in any other setting. It picks up the need for housing. It picks up the need for a speech pathologist. It picks up the need for domestic violence services. It picks up the need to care for the whole child, the whole family, and the whole community. Even though we know this works, the truth of it is the current policy settings don't make this easy. The truth of it is, in most of our vulnerable communities, there aren't enough services for our families, and there aren't enough sectors and with the ability to walk into rooms like this or to start being able to have a conversation about how that conversation needs to change. How do we get a service system that genuinely thinks differently about how it should operate? Now, we've heard about closing the gap today as a sort of, again, a gold standard in policy. So there are two things in that. One is, when we talk about closing the gap, we're talking about a set of targets across a realm of domains that are critical for success. When you hear people like me talk about it, you'll hear me talk about the national agreement. So the two things interrelate, and it's the national agreement that has made the closing the gap targets what they are today. So the national agreement is where we set out 4 priority reforms in negotiation with the 80 peak bodies across Australia and the 800 services that they represent. And it said, in actual fact, you have to transform the way you work. Those targets are what governments need to measure, but they're missing some critical things like child safety. And using the national agreement to change the way governments work, we were able to put in targets that related to the safety and well-being of children and the development of children for the first time. The national agreement is what's given us things like a policy partnership, where we're able to work with governments in the room, bringing in experts, bringing in lived experience, bringing in the sectors that work for the organisations that work in that field, and say, what is currently going on and how do we move it? Believe it or not, everything that they said had been identified decades before. We've heard about that too. The national agreement talks about doing things different. The problem is, and you would have heard this from the Productivity Commission at the beginning of the year, getting governments to move on those transformational elements is really, really hard. It's a bit like moving a dinosaur in a car park. A couple of things have to get crushed first, a couple of things get bumped before that dinosaur can genuinely move around that car park. What we're continually asked is, how do we make the difference? And in any of those rooms, we continually go back, and let me be clear, some of them are moving. Shared decision-making makes a difference. Talking to the people that are impacted on by your policies and practices makes a difference. Again, the difference in this particular policy is that once upon a time we were invited to jump in the car, come along, sit next to us while we drive this car. The difference now with things like policy partnerships is we are building the engine that drives the car. But it's fragile. It's fragile because anything that exists in policy is fragile. But we know when it's done differently, we get different outcomes, because it enables us to share our incredible knowledge and our expertise, and it enables us to share that expertise at every single part of a process. It means that we get a more responsive outcome. It means that we get stronger policy analysis, and ultimately it means we get better outcomes for children. The policy partnership is also how we got the National Commissioner for Aboriginal and Torres Strait Islander children and young people. Now, this has been an advocacy call for more than 40 years. More than 40 years. It's also been identified as an accountability mechanism in multiple reports. And it's described in many, many ways, but this is what it's been talking about. It's been talking about an accountability mechanism that is able to work with every single state and territory with similar accountability mechanisms, that is agile, that is fast, that is the voice and champion for our children, that offers them for the very first time that person they can speak to when no other voices or pathways are available to them. It is not what is different to the Commissioner and a Royal Commission is that it is on the ground fast, it is responsive, it works alongside every single government in Australia and helps transform those policy settings. It calls it to account, it shines a light into every deep and dark recess, and it works with its communities to dismantle what created that deepness and that darkness. Again, when we talk about some of the policy changes and some of the conversations that need to change, on the anniversary of The Voice, we heard a commitment to get rid of the National Aboriginal and Torres Strait Islander Children and Young People's Commissioner as a first act of Parliament. A commitment to get rid of the only mechanism, accountability mechanism of its kind, the only one designed to genuinely be able to peer into the darkest of those recesses. That is the conversation that we battle every single day. And it's an example of why we need to strengthen everything that sits around the policy environment to ensure that those voices aren't wiped away. We know that we're getting progress in some areas, but we know that that progress is far too slow. We know that at the heart of it, people like you will be incredibly helpful, and your voices will be incredibly helpful in bringing forward what we need to collaborate and how we need to change. And more importantly, how we absolutely need to change. A couple of the other things that are starting to hit the ground are concepts like connected beginnings. Now, again, connected beginnings has been around for quite a while, and it was the biggest investment by the federal government into early education outcomes for Aboriginal and Torres Strait Islander people. And using the national agreement, we were actually able to pick up this piece of work, this policy setting, and say, we don't think it's working in the way that you think it's working. And one of the fatal flaws in it is that it's currently being delivered by non-Indigenous entities, which means you have massive gaps in your service delivery. A case example of that would be one of the communities in Victoria where it was awarded to the contract for Connected Beginnings, which is an integrated service model that brings in health and education and everything in between to make sure that by the time a child hits preschool, it has had every opportunity to have all of its needs met, and that we're closing that gap in developmental outcomes. This particular example, over here you have a multifunctional Aboriginal childcare service already doing all of those things. And on this side, you had a non-Indigenous childcare service without a single Aboriginal child enrolled in it. And the policy settings at that time drove the funding over here to the service model that didn't even have a relationship with a single Aboriginal child. The national agreement is the piece of policy that was able to identify it quickly and then identify how that happened, change the practices, change the policy settings so that that doesn't happen again. So today we now have 49 Connected Beginning sites in Australia. 30 of them are currently Aboriginal community controlled. At the beginning of the national agreement, there were 2. Of the remaining 20, all of them are set for transfer in service delivery. A couple of the other things that we're starting to see hit the ground involved improving multidisciplinary responses. Now that's a really bureaucratic name for something that basically says there are gaps out there. There are gaps that our service systems know about, there are gaps that our communities know about, there are gaps that our services need. And they need to come up with a model that fits their own environment to pick up those gaps so that service delivery is integrated across every voice, every door that a family might walk into. And these things are based, again, on our cultural practices. So improving multidisciplinary responses is really just another word for community. Again, developed in partnership with us and our leadership groups and our communities. The other piece of work that we're extraordinarily proud of is our Bird Project. Now, the Bird Project developed a trauma-aware, healing-focused and culturally appropriate national training package for healthcare workers. This one specifically designed to pick up disclosures of child sexual abuse, whether that is a current case or a survivor. The Bird honours the depth and breadth of lived experience, and it works on decolonising frameworks. Again, there's an uncomfortable word. It says, how do we bring in our practices and our wisdoms, and how do we make these conversations easier and safer for our families? It recognises that child sexual abuse has actually been exacerbated by trauma and marginalisation of our families and our communities but more importantly, our victims. It recognises that the current systems are not safe or responsive for Aboriginal and Torres Strait Islander adults or children, and that they don't recognise or facilitate our cultural healing practices and how we use our own tools to protect ourselves. It recognises that fragmented systems only lead to holes and gaps. It recognises, most importantly, that a system that is focused on protecting itself will never protect our children. And it visions a different model. We know that safety is supported by Aboriginal and Torres Strait Islander cultures. It is supported by love and care. It is supported by joy. It is supported by creating a nest where children feel supported, where they feel nurtured, where they're able to disclose instances of harm, where they're able to heal from child sexual abuse. Interestingly enough, you'll see I have my nest with me. Now this one was built by my mothers from the NPY region because they were concerned about the conversations that I have to have. And so they built me a nest to take with me wherever I go so that anything that's harmful or anything that's hurtful is in there. You'll notice it matches my earrings again. Those earrings were built by my families and sung. You hear us talk about sung. They put law into them so that when I come into these rooms, I come with the cultural authority that carries their voices, but it protects me and helps me heal and helps me stay strong. Now, these might seem like little things, but these are things that we know keep us safe. I have my oil. Again, these are things that Aboriginal and Torres Strait Islander people know, that the oil is healing, that the oil, again, protects you in any environment where you might feel unsafe. And they've said to me, the next few months, Catherine, are going to be hard. We're already hearing the voices that want to deconstruct everything that we've worked for, gaining momentum. Maybe you can refer to it as dingoes singing. You're going to need your nest. Your families are going to need their nests. They're going to need their law. They're going to need their strengths, because right at this moment in time, our voices will be drowned out by the singing of those dingoes, by a singing of a story that talks about our own communities as unsafe, by a story that once again calls for another Royal Commission into our families when we've just had one. And what it said was that our families keep our children safe. I don't really want to reiterate everything that's already been said. We know how many recommendations are out there. We know how much synergy is in those recommendations. We know that what they say is make sure every child has a home to live in. What they say is make sure families have safe places to play. What they say is integrate your service delivery responses. What they say is actually care about children, not headlines. We can be more collaborative. I know I've said it and I'll say it again. If we invest in our echoes, we get a better, stronger response to all of our children. We're able to hit the ground faster. We're able to run at problems with bravery. And sometimes, as you'd know, it takes a lot of bravery to talk about really uncomfortable conversations. We know that we need to smash down every single one of those silos, because as they were built to function the way they are. Without smashing those silos completely, all we are doing is reiterating the mistakes of the past. We know that when we do it collaboratively, we can push those silos over faster. We know that we can focus on service delivery and doing what's best. We know that we can provide our children and our families with the highest quality support. We know that our children and families can be happy, and they can be healthy, and they can be thriving. And the last point I'd want to leave you on is when I talk about the story of the emu, and hopefully you've been reiterating what that emu could have been in every point of my conversation today. I think the image I need to leave you with is often those stories don't only talk about policies and frameworks for behaviour, they talk about people. So my closing thought is to think about that emu as a child, alone. Its only mechanism for safety was to run, and it can no longer run, and it can no longer hide. who's going to worry about that child? Thank you.
Can you please stand and thank these three commissioners who have given us reason for action and hope and just to convey to you all that this group is standing with you and that we are filled with inspiration about action and implementation and accountability. Thank you. Thank you, Anne. Thank you, Micaela, and thank you, Catherine.